Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Fox-Fordyce disease. Fox-Fordyce disease. So this Fox-Fordyce disease is also known as the apocrine malaria. It is aka the apocrine malaria. And it is characterized by intrinsic pruritic, so this pruritic, and there is pearly papules in the apocrine areas. White pearly papules in the apocrine areas. Next, it is commonly involved the axilla and then the areola. So it involves the axilla. Then it also involves the areolae. It is commonly seen in case of women. So the condition, it occurs as a result of the apocrine sweat glands and sweat duct. So it involves the apocrine sweat duct. So it involves apocrine sweat duct occlusion by aggregates of epithelial cells and occlusion by aggregates of the epithelial cells and this is of the apocrine or the apoecrine secretory cells of the apocrine or the apoecrine secretory cells. So the earliest pathological sign will be pathological sign is nothing but it is known as the small vesicles in the apocrine glands. Small vesicle which is present in the apocrine glands. Next, in the apocrine duct, to be specific. Next, later the apocrine glands are seen enlarged. So the apocrine glands, they seem enlarged, and as a consequence of repeated inflammatory events, there is a perifollicular xanthomatosis with the perifollicular foam cells. So there are repeated inflammation which takes place, and there is a perifollicular xanthomatosis. And with the perifollicular foam cells. And this expresses CD68, it develops. So how do you treat this Fox-Fordyce disease? So treatment is there is first line, second line and third line. So what is the first line? The first line, it includes the topical intra or the intralesional steroids. Next, the topical clindamycin lotion. Then comes the topical retinoids. Now moving on to the second. The second, it includes the UV light as well as the oral retinoids. Next, let's move on to the third. The third line, it includes the surgery. So here there is a difference between the Fox-Fordyce disease. So there is a difference between the Fox-Fordyce disease versus that of the spot. Thus, Fox-Fordyce disease, it is due to, this will be due to the ectopic sebaceous glands. This is due to the ectopic, this will be due to the ectopic sebaceous glands. Channel.